Top 10 reasons why your periods may be irregular. Welcome to Justine Haynes. We have almost 1 million visitors on Quora and get asked this question all the time. What is wrong with my period? Good news, this happens to many women. The list of reasons why a woman has an irregular cycle is long. However, we've narrowed it down to the top 10. Number 1, puberty. Nothing is more normal than irregular cycles for a young girl who's just had her first period. Because hormone levels fluctuate so much during puberty, teens tend to have longer or shorter menstrual cycles. A young girl's menstrual cycle can even take up to 5 years to become steady and regular. Remember, your body may be trying to tell you something, it's important to listen. Number 2, weight excess. An overweight woman will produce too much estrogen, which tends to cause irregular, heavy, and very long periods, often lasting more than a week. Add to this, the prolonged menstruation can also cause the risk of endometriosis, which is a painful disorder where the tissue that normally lines the inside of your uterus or the womb grows outside of the uterus. This is painful. Doctors will often prescribe oral contraceptives to thin it out and reduce these risks. Number 3, endometriosis. This happens when tissue similar to the lining of the uterus or the womb grows outside of the uterus. More than 11% of American women between 15 and 44 are affected. This will cause them to experience abdominal pain, cramping, pain during intercourse, and irregular periods. Sometimes symptoms are so intense that the woman will feel like she's having consecutive periods. If you suffer from these symptoms, go to a gynecologist who will probably order a pelvic MRI or a laparoscopy to get the proper diagnosis. If you're suffering from endometriosis, your doctor may prescribe an oral hormone or surgery depending on the severity of the situation. Number 4, sleep deprivation. Do you know why they tell women who want to get pregnant to rest? That's because messing with the body's internal clock will definitely affect the reproductive hormones, which in turn influence ovulation and menstruation. Chaotic sleep schedules also have consequences on your body's production of melatonin, which is a hormone that influences reproduction. If you're consistently on jet lag with a crazy sleep schedule, close the curtains in your bedroom to limit the upset of your internal clock. Female travelers often have disturbed cycles. Number 5, intense exercise. This is not an urban legend. A series of very physical workouts combined with very low body fat can stress your body so much that it will send a signal to the brain telling it to stop producing fertility hormones. This is because your brain will assume that your body is not in the condition required to feed a baby. Do not panic. Everything usually returns to normal as soon as you slow down the intensity and regain some body fat, depending how low it is. When the absence of period continues, it's important to see a gynecologist, as this could be a sign of amenorrhea, which is the absence of menstruation. Number 6, the thyroid. 1 in 8 women will develop thyroid problems during their lifetime. The thyroid is a hormone regulator in your body. When the thyroid is off, so are the periods. Irregular menstrual cycles can be caused by thyroid overactivity and underactivity. If you're always cold, constipated, constantly tired, have a very heavy period, pale skin, puffy face, slow heart rate, have gained an unusually large amount of weight in the last few weeks, you may have an underactive thyroid. On the other hand, people with an overactive thyroid tend to feel very irritable, suffer from unexplained weight loss, often feel hot, have swollen eyes, diarrhea, insomnia, fast beating heart, and more. If you think you may have a thyroid problem, go to an endocrinologist who will prescribe the appropriate treatment. Number 7, uterine fibros. These are benign tumors that develop on the lining of the uterus. This can be caused either by genetic predisposition or hormonal disruption. Uterine fibros can cause very heavy and frequent bleeding, as well as menstrual discharges. Women with uterine fibros will feel a pressure on their pelvis, with the constant urge to urinate, lower back pains, and pain during sex. The doctor will investigate through a pelvic ultrasound or an MRI. If the fibroid is really large, the surgery may be necessary. This is why it's important to see a doctor when you notice that your cycles are irregular, when your bleeding is too heavy, or when you experience pelvic pain. Number 8, hormone therapy. Thyroid medications, steroids, or antipsychotics, which replace dopamine, can disrupt the hormone receptors and therefore affect cycles. If you're regularly late or a week early, talk to your gynecologist or the doctor that prescribed your medication to find the best suitable combination that's right for you. Remember, your body may be trying to tell you something, and it's important to listen. Number 9, micropolycystic ovaries, also known as PCOS. Symptoms of PCOS include abnormally spaced periods, which means going 6 to 10 weeks between 2 cycles, as well as excessive hairiness and acne. PCOS is one of the most common causes of female infertility, affecting almost 10% of women of reproductive age. This condition is evaluated and diagnosed through an ultrasound. If you're diagnosed and suffering from PCOS, your doctor may recommend that you lose weight if necessary and prescribe oral hormones. If the cysts are very large, surgery to remove them may be necessary. Number 10, premenopause. Hormones begin to change in women in the years leading up to menopause. This cycle can last up to 10 years. During this time, women will experience irregular cycles, either longer, shorter, no periods at all, or lighter flows. Hot flashes are very common symptoms. Menopause is fully reached when a woman has the absence of period for 12 consecutive months. As you can see, there are many causes to an irregular period. Most of them have a simple and easy solution as long as you do not procrastinate and ignore them. All women should visit their OBGYN each year, even the youngest and the healthiest. Make sure you use a tracking app. You're probably taking your car for oil changes and checkups on a regular basis, whether you're doing the same thing for your body. Got a period question? Check out our blogs at JustineHaynes.com and get all your period facts. Like and follow for more valuable content. See you next time.